Welcome to Your Future, Your Way, where we explore the many ways to reach your academic and professional goals. Whether you are a recent grad, considering career advancement, or even changing careers, this podcast is for you. There is more than one way to do higher education. This is Your Future, Your Way. My name is Alyssa Olick, Assistant Dean for Professional Degrees and Certificates, which is part of the professional programs at the University of Wisconsin-Madison. We are excited to share information, resources, and most importantly, stories from current and former students.
Before we start, we want you to know that the views, information, or opinions expressed in this podcast do not necessarily reflect the views of the Division of Continuing Studies, the University of Wisconsin-Madison, or the Board of Regents.
The field of health and medicine is expansive, encompassing everything from science and research to clinical practice and public health. In order to meet the demands of this field, there are more than 20 health and medicine programs in the professional degrees and certificates portfolio offered by UW-Madison. Within our portfolio of health-related programs, we offer bachelor's, master's, and doctoral degrees, as well as capstone certificates. Areas of study range from nursing to clinical nutrition to global health and more. Clinical nutrition, this episode's featured program, is one program that offers both a master's degree and capstone certificate option. Michaela Schuchart is the program manager for the clinical nutrition professional programs. In addition to her role as program manager and instructor at UW-Madison, Michaela works as a registered dietitian nutritionist at UW Health. She provides an overview of the professional programs available in clinical nutrition, as well as how they prepare practitioners interested in the field of health and medicine.
The capstone certificate and the Master of Science in Clinical Nutrition, which I'll keep referring to as the MSCN, those are both 100% online professional degree programs. The primary target audience are practicing registered dietitian nutritionists or RDNs, plus also students who are training to become RDNs. But since our program covers clinical nutrition, it is very relevant to other healthcare professionals. This includes physicians, nurse practitioners, physician assistants, and pharmacists, to name a few. The Master of Science in Clinical Nutrition is 30 credits and can be completed in 3 to 4 semesters with full-time study. For professionals who are working full-time, it typically takes about 18 months to 2 years doing a part-time study curriculum. The capstone certificate is only a 9-credit program. So those 9 credits can be chosen from the Clinical Nutrition Master's program, and this can easily be completed within 1 year. So the emphasis of the program is clinical nutrition, which means that majority of the students work in hospitals, clinics, long-term care facilities, and more unique areas such as dialysis centers and eating disorder programs. They are the interdisciplinary healthcare team member that provides medical nutrition therapy to treat or support a patient with a wide range of chronic diseases or medical conditions. But I think a common misperception of what RDNs and clinical nutritionists do is that we simply tell people what they should and shouldn't eat. So in fact, we use nutrition to help support the treatment of a wide variety of diseases. So some examples right here in Madison are with UW Health, that's our academic medical center. And at UW Health, we have 5 different ICUs or intensive care units. So many of these patients can't breathe on their own or eat on their own. So the dietitian works to feed them through other means and works in conjunction with the physician, nurses, and pharmacists. So the exciting thing is that the field and the demand will continue to grow. So actually, the US Bureau of Labor Statistics predicts that the number of jobs for registered dietitians and nutritionists will increase by about 11% through the next decade. A large contributor to that increased demand is our aging population, but we also see growth in kind of non-traditional roles for individuals with a strong background in nutrition and particularly clinical nutrition. So this includes everything from working for food companies, grocery stores. uh, a lot of collegiate and professional sports teams want dietitians with more clinical knowledge to help their teams and athletes, and the really fast area of telehealth. This has really become a booming industry since the COVID-19 pandemic. So that includes, hospitals and clinics who are utilizing telehealth medicine in their clinics, but also the world of wellness and nutrition therapy apps. So there's a lot of startup companies where you can reach your target audience not through hospitals and clinics, but through different technology. First, it's important to understand that by just completing our Master of Science in Clinical Nutrition or another graduate degree in nutrition, doing that alone will not lead to a practice credential. If you're looking to gain employment within the healthcare industry, you need to have a graduate degree plus complete at least 1,000 hours of supervised experiential learning, which is essentially kind of the residency year to earn that credential. So here at UW-Madison, we offer a pathway to that RDN credential through various partnerships throughout the country. So here in Madison, we have a partnership with UW Health, which is the academic medical center of campus. We also have a partnership with the Mayo Clinic in Rochester, Minnesota, and Virginia Commonwealth University in Richmond. So our partnership programs, they offer those residency hours and that type of program, and then we offer the graduate coursework required to do that. If you already hold a practice credential, such as an MD, physician assistant, or nurse practitioner, this degree can definitely help advance your knowledge in the field of clinical nutrition and allow you to better care for your patient.
We will return after this short break.
This episode of Your Future, Your Way comes from UW-Madison Professional Programs, offering over 90 graduate-level programs including online and evening and weekend options for working adults. For more details, visit us at go.wisc.edu/pro.
Alyssa Stiles, an alum of the Masters in Clinical Nutrition program, is an inpatient registered dietitian at UW Health. She is a Badger through and through, as she completed both her undergraduate and graduate degrees at UW-Madison. Alyssa discusses her role as a dietitian in a hospital setting, as well as how her degree prepared her for the demand of her career in health and medicine.
So my workflow is very much cancer center focused. However, there are a lot of commonalities with my coworkers who work as an inpatient dietitian who focus on medical nutrition therapy. Our days are pretty busy, but they're always interesting and changing from day to day. Each morning, we kind of log in and look at our patient list for the day, see who is at high nutrition risk, who needs to be reassessed, who may need a little extra follow-up, depending on if they're on tube feeding or if they're struggling with eating, or if they may have another nutrition-related issue. We kind of look through our list and then figure out what our plan is for the day. In the field of clinical nutrition, I think it's definitely a more up and coming field. Dietitians have been used greatly, in the past with helping provide tube feeding and diet education. But I think we're even getting to another level of medical nutrition therapy where we're really showing the benefit of having a registered dietitian on a healthcare team. When we look at any kind of disease state, you can really kind of use nutrition, potentially as even in a preventative medicine approach with like culinary nutrition. And if you have a family health history of a certain kind of heart condition, you can try to adjust your diet earlier on and have healthy eating and exercise habits to kind of address that. And then now even, when we have more complex disease states, like we talk about COVID, and recently, when that came through our hospital and we had to kind of adjust our practice, we were like essential with those patients who were intubated and sedated and trying to meet their nutrient needs when they were in respiratory failure. And the doctors and the other care team members really depended on us for offer that care to try to help our patients through a really tough time in their life. I chose to earn a master's degree in clinical nutrition because I believe nutrition is a foundational building block to overall health and well-being, and that to live a healthy and happy life, people must have a balanced diet with the appropriate nutrients. I chose to earn, in my bachelor undergraduate career, a degree in dietetics and a global health certificate, and to focus my career on helping people to improve their lives through better nutrition. I'm very passionate about helping people enhance their future through improved nutrition and to prevent disease or help cure disease. I tend to want to work with individuals to develop a feasible diet and nutrition plan that'll assist them with having the best overall health and life possible. And one of my little taglines for most of my patients is, you've got to nourish to flourish. So the UW-Madison program has great professors that always have a firsthand knowledge of what they're talking about. And that's really hard to get from some universities and institutions. The professors all do research in the area that they're presenting on, or they actually practice themselves. So they know what they're talking about, and they make it really easy to relate the material you're learning to real life and what you'd be practicing as a dietitian or in another nutrition related field. So having that knowledge from the professors is super helpful to translate it to your everyday work. I also love the program because it allowed me to work while also completing the courses. And it had that flexibility that I could choose the pace I needed to finish my degree.
Thank you so much, Michaela and Alyssa, for sharing the impact the clinical nutrition programs make on the field of health and medicine. It's always great to see how the courses and curriculum in our programs lead graduates to continue to grow their careers and make an impact in their fields. If you're interested in learning more about our professional program offerings in health and medicine, including clinical nutrition, go to pdc.wisc.edu and click Explore Programs on the top of your screen to get started. Join us next time to learn more about professional programs at the University of Wisconsin-Madison. Learn how to shape your future your way.